Hello, my name is Dr. Niccole Bruno. I'm a graduate of Cornell University, DVM class of 2006. I'm currently the Chief of Staff of a VetCor-owned small animal practice outside of Houston, Texas. Prior to coming to Texas, I practiced in Long Island, New York for 11 years. Even being in a diverse city such as New York, many hospitals, I was the only person of color in the room. At times, it was isolating as I witnessed and encountered microaggressions from clients and colleagues frequently. I didn't feel that speaking up would change much, so I kept quiet. I felt I had to assimilate into the culture in order to survive. When I first had the opportunity to become a leader in a hospital, I knew that I would have to make a big impact on hospital culture. I also felt this weight on me, being a woman, and not just that, being a person of color to succeed. I was replacing veterinarians that were white male and of the baby boomer generation. Although their medicine may have been progressive, their hospital culture was homogenous and stagnant. I knew as a leader, I was determined to transform the hospital culture, and I knew it was going to be dependent upon the veterinary team that I created. I'm a firm believer that you're only as good as your support staff. And I knew that having an exceptional veterinary team was going to be my most valuable asset. Today, I will demonstrate why having a diverse veterinary team brings value to your practice. Veterinary medicine is the most least diverse medical profession in this country. In a 2013 article featured in The Atlantic, veterinary medicine was highlighted as the most white profession. Veterinary medicine has historically marketed itself as a white profession, and thereby we are reflective of that today. When I Googled veterinary medicine, these were the images that came up for me. All white faces seen in support staff and doctors. How can children of color see themselves in this role if they're not represented? How can they aspire to be in this field? According to the 2019 US Bureau of Labor and Statistics, veterinarians are 92% white. In 2019, the American Veterinary Medical Association highlighted that 2% of veterinarians are Black and 3 to 4% of veterinarians are Hispanic. These numbers are proof alone that we have a diversity problem. This trend will continue because the AAVMC, or the American Association of Veterinary Medical Colleges, reports that less than 20% of currently enrolled students are underrepresented racial minorities. So why does this lack of racial diversity in veterinary medicine even matter? One, it matters because the demographics of the United States is changing. Currently, 61% of the population in the United States is white, while our profession is 92%. So there are already disparities there. At the rate our population is changing, it is predicted that in 2045, less than 50% of the population will be white and almost 25% of the population will be Hispanic. Since our current demographics doesn't reflect the market that we serve, imagine what will happen in 25 years if we as a profession don't collectively address this as a crisis. Two, it also matters in vet med because our consumers reflect a variety of different races, ethnicities, religions, gender, and sexual orientation. Our ability to connect with our clients is based on communication. Effective communication allows us to establish relationships and build trust with our clients. Understanding that cultural differences can complicate communication and have detrimental effects on patient healthcare is paramount. For example, if there is a language barrier, then the veterinarian cannot adequately explain the disease process, the diagnostics involved, and the treatment plan with your client. If a client doesn't understand that there is to be follow-up examinations or recheck lab work, then we are doing a disservice to the client. If in the end, the pet doesn't get better and the client's trust in us is eroded. If we hire bilingual employees, then we can have someone else translate for us, immediately removing the language barrier, and most importantly, providing all pets the best access to veterinary care. We also provide an avenue for client education, which makes us more productive when our team can educate on our behalf. So how do we diversify our veterinary teams? First, we must assess our practices. Examine the racial, socioeconomic, gender, sexual diversity of your teams. Is your staff reflective of the people that you serve? What are the limitations of your practice based on the diversity of your community? Are there even language barriers? Number two, you have to be intentional on how you hire. I practice in Houston and there is a heavy Latino community here. I am looking for employees that are bilingual in Spanish, and because I am not fluent, and I want to ensure that we can communicate with our Spanish speaking clients. If an applicant doesn't have veterinary experience, then I'm looking for other work experience. I'm looking at customer service or childcare because those are transferable skills. Some of my best hires have had no veterinary experience, but they had a drive to learn and compassion for animals. This doesn't mean that veterinary experience doesn't matter, because it certainly does. Just keep an open mind, because you can miss an opportunity for growth if you limit your candidates based on just veterinary experience alone. Marketing is also another important skill to grow your hospital. I look for creative employees that have an eye for social media. My team will help post on my hospital Instagram and Facebook pages because they can target a different generation than mine. They're younger than me and they understand the language. So we are strategic in our postings. We try to acknowledge the calendar year. We try to recognize religious differences. And we, most importantly, market ourselves by posting ourselves, because then we show the community that we are diverse. When you have a diverse staff and can tackle barriers, then you've done three things. One, you've established a connection of trust and service for your clients. Your clients see themselves represented in your hospital. That strengthens your relationship and retains your client. Number two, you've incorporated your employees into the education and treatment process, making them feel value within your veterinary practice. Your Latina technician is filled with pride that she can help to translate and build trust with your clients. This team member then adds value to your practice by being able to explain disease processes and learns the art of communication. This usually encourages them to want to excel and do more. Perhaps they may look into translating your hospital intake forms into Spanish or making brochures for your clients. Staff morale improves when people feel they can bring their true selves to work. Three, increase services and profits. Your clients will agree to services because they understand the importance of the treatment, they find value in the service, and they trust you with their pet. This means that when they have a favorable experience in your practice, they're going to refer their clients and friends to you, which means increased clients, increased services, and increase in profits. The benefits of diversifying your veterinary team are limitless. When you have people offering you different backgrounds, perspectives, and experiences, it allows for the influx of new ideas and services that you can provide to your community. The key as a leader is being willing to be receptive of those ideas and perspectives in order to improve innovation in your hospital. This is true definition of inclusive leadership. If we can diversify our teams and create inclusion in practice, then we can change the narrative of what this profession looks like and strengthen our ability to serve the community. Thank you.